Hello everyone, this is NAINA MD, Fusion of Science and Beauty in Beverly Hills, bringing you the best of anti-aging and regenerative medicine. And one of the topics today, I'm so amazed to have a guest here. She's fabulous, and the topic is really about breast cancer. You know that that's a subject that is very near and dear to all of our hearts. This is Dr. Leslie Memsic. She's a breast surgical oncologist over 20 years. She's fabulous. Right here in Beverly Hills. She's a top-notch, about as best as you can get. Welcome to my show.
Thank you. Thank you for having me.
Thank you so much for being on. And I think I want to start really today the show by asking you to just describe to the audience really, you know, breast cancer has been 20, 30 years ago. We would hear the term breast cancer and it was like a death sentence. You know what I'm getting at.
Absolutely.
And we have progressed so much. In terms of how we're dealing with it, in terms of women who are living amazing lives as a result of having had the treatments. So just tell me what has the changes been that you've seen as a practicing surgeon, and what are the changes in the treatments and the modalities?
Almost every aspect of breast cancer treatment and awareness has been revolutionized in recent years. Number one, I think most women are aware of breast cancer. In the old days, patients would arrive with really advanced cancers.
Yeah,
now, because of the Komen, Avon, everyone knows what the pink ribbon means. Many people are aware of their family histories.
So in other words, early detection.
Exactly. So people are coming in earlier and getting themselves checked out. Number two, radiology. Radiology techniques have been revolutionized. Besides mammogram, now we have digital mammogram.
Right? We have the digital MRI.
Correct.
And even the resolution, right? The resolution is gotten. We've got 3D imaging now and all those things.
Right. We catch things better, and we have less radiation involved. So our radiologic techniques have markedly improved. So we catch cancers earlier.
And they're becoming safer, because I know one of the key things is women saying, "Oh my gosh, what about my radiation exposure to just even the mammograms?" And
Correct.
So forth.
The radiation has gone down, our detection has gone up, and to date there is, even though it's a concern, there's never been an instance where breast cancer has been caused by the imaging to find breast cancer. Right. Surgical techniques have radically improved. Okay, now we do, first of all, the majority of women that have a cancer only need a lumpectomy, where you just remove the tumor, you check a lymph node, and you give radiation therapy, and you have a great-looking breast without having to remove the breast.
And I remember when I started, and, I was a surgeon when I first started my career. We did mastectomies on things that we normally now don't do.
Correct. Right? So most women don't need mastectomies. So those women that do need mastectomies, we now do skin-sparing, nipple-preserving total mastectomies with immediate reconstruction. I have patients that go to the beach and have topless photos of themselves. No one would guess they'd have mastectomies. So that is remarkably different. In terms of the lymph node, we used to take out all the lymph nodes.
Remember that?
Now,
and then they would get the swelling, right? Because
it's horrible. The side effects would be horrible. Now we take out one lymph node to check to see if it's cancer. We have called a sentinel lymph node.
Right.
And things are moving to maybe a point, as our imaging improves, we won't even have to take out one lymph node. So the surgery is dramatically improved. And then the chemotherapy. And the chemotherapy in the past was horribly debilitating. Your
women that were the quality of life was just not there for them.
It was horrible. Plus, they would die anyway. Now, not only do we have chemotherapy that really works, we have minimized a lot of the side effects. And we now are tailoring our chemotherapy to specific molecular tumor markers. Right.
Which is my favorite subject, the genomics.
That genomics is a totally game changer. Now we can look at a woman's tumor, find out all about it, and so when we recommend chemotherapy, we're
it's going to be very specific.
Correct.
Right?
We're not giving your mother's chemotherapy. We're not giving something
Welcome to personalized medicine.
Exactly,
right?
And that's made such a difference. We don't undertreat patients and we don't overtreat patients. We're not exactly where we need to be to make it perfect, but we're well on our way. So it's very, very exciting.
So if all of this has really changed, look at the amount of how much how much you've kept up on everything, right? I mean, you're in I think for doctors in this field, you've got to be up on everything all the time because there's so much change. It's evolving. I remember when we used to get out of medical school and we used to have our textbooks. I think the textbooks are outdated by the time, where we're really in a health revolution. right?
That is absolutely true.
We talk about tech revolution in terms of computers and all of that. We're in a health revolution. No sooner do we adopt one thing or one technique, whereas 2 or 3 years that may be outdated and you're on to another technique or whatever, right?
Right, and if you're not keeping up, you're doing your patients a disservice because...
And I think that's really what I wanted the audience to see and why I brought you on, is because that's my respect and my passion, is when we are trying to bring credibility into, let's say anti-aging regenerative medicine or any evidence or any integrative medicine and even conventional medicine. It's so important for the audience to know, is this doctor keeping up with the current trends and with the current knowledge? And I think that is so important. Reading every day or keeping up on what's the latest and greatest in techniques is so important. And obviously you do, and I think that just needs to be stressed. Yeah.
Yeah, I agree. And the thing is that I tell patients, if they're given some bad news, they just have to hang in there. There's research every day. There's new things on the horizon that can revolutionize how they're being treated. And so you just have to hang in there and stay optimistic and stay in touch with doctors who are in touch.
Yeah. How do you empower patients? Because so much of it is like when you have this breast cancer, you're just like, oh, it's more of a, a lot of people feel helpless, okay? How do you as a surgeon help to empower your patients?
Well, I think the most important thing is to remind them they're going to be okay, that we have lots of tricks up our sleeves, and then that we're all on the same team. It's not that they're the patient, I'm the doctor, they're the sheep, I will tell them exactly what to do. I want to explain all their options, and there are always options.
In other words, you're making the patient become proactive.
Correct.
And involved, not like the traditional approach where it was like you just tell, and I'm the healer. It's you're involving them in the healing process.
Absolutely, and there are patients that sometimes make choices that perhaps I wouldn't make, but it's all about them. I respect them, they know themselves, and I'm supportive of them throughout the process. And really, the process is forever.
Yeah, no, absolutely. When women once you've treated them, they go through the chemotherapy and so forth, what have you generally seen in terms of, I know as a surgeon you give it the case to the back to the primary care or back to the oncologist or radiologist, but do you remember, like, do you still as I'm just asking from a surgical point of view, do you keep in touch with those patients? Do you see a sense of, like, obviously you've bonded with those patients, they're very dear to you. How do you deal with that?
Well, I think a lot of surgeons do see themselves as technicians, and they do hand their patients back to the other specialists, in cancer or in medicine. I never do. I always tell patients they're stuck with me forever.
That's
because I just think that
and I always hear this is really important.
I have gone through so much with them, and you've got to presume you're going to live when you have breast cancer. You go through the treatment, but you have to make lifestyle changes potentially. You have to make sure that you do live forever. And sometimes you've had changes having gone through chemotherapy or radiation therapy or surgery, and I want to work with the patient to make sure they get their entire new and improved life back. And that could improve different eating habits. We want to make sure the cancer never comes back.
Exactly.
And that they have the great quality of life they deserve.
What would you recommend? Let's say once a woman has had in terms of screening and testing, has that changed? Because women are living longer now. So that's going to be for my next show with you, the quality of life issues that these women are going to face because they're living longer, correct? You're catching early detection, you just mentioned, better surgical techniques, better radiographic imaging techniques. So now these women are living longer. What are they faced with? Do you see sometimes quality of life issues because the hormone declining?
Oh, absolutely. I think that a lot of the original techniques for treating cancer was made to treat the cancer, which is great. That is your number one priority, but you've got to realize these women are going to live, and they have to have not only a long quantity of life, they have to have a great quality of life. And I think that it is my role, along with their other physicians, to help them live this wonderful life that they've got back.
Yeah. I'm going to just tell you in terms of, because again, my passion is for integrative medicine, regenerative, anti-aging, bringing credibility into it. One of the things which I was faced with is, as you know, because sometimes the women are not able to do the hormone replacement therapy, is osteoporosis. right?
Yes.
That becomes a huge issue. They're going to live a lot longer. Their bones, you want to do everything you can to prevent their bones from becoming brittle and so forth, right? The choice is that if they do reach a stage where they're showing bone loss, then they go on a drug that's generally given to prevent that bone loss, which can have its own set of complications, as you know.
Correct.
And so what are some of the early and detection? For example, women are doing Dexa scans. But that is a test that tells you sometimes 2 years later if you've been having bone loss. It's not a real-time functional test. So what we do is we do sometimes a DPD test, which is a urine deoxypyridine test. And what we're starting to look at, what I look at, is what are the bone markers? Is this woman in real time today having more bone loss, more osteoclast, which is called osteoclast, breaking down the bone? Having said that, then once, if we do that test, and it's a urine test, simple test that can be done in any lab, and once we do that test, then let's just say she is having that osteoclast, breaking down bone, there are certain nutrition, what we call nutrigenomic interventions. So there's certain nutrients that you can implement and lifestyle modifications where 4 months later I do that test, that score is so much improved. So you know right away you've impacted that person to have less of that, what we call the breakdown of that bone, which in 2 years is going to reflect on the Dexa scan.
I think it's incredidly important to be proactive.
So that's
you
what
don't wait
you don't
and then
wait.
play catch up.
That's what and I think it's so important that in medicine we start to realize that we've got to look for tests other than just, like for example, things that are going to be predictive of 2 years or 3 years, something that's metabolic testing, functional testing. And that's again going more into, of course, the genomic testing, which is, we can predict based on the basis of genomic testing even what nutrients that you need.
I agree.
So again, I know we're running out of time because you're going to come back on a show. Promise you're going to come back because we still have the whole lifestyle.
It's a fascinating subject.
Modifications to address. How do they look you up? How do they find you?
My office is in Beverly Hills on Bedford at the Bedford Breast Center, and also they can look me up on the web under Leslie Memsic MD.
And what is the telephone?
310-337-9668.
Okay, perfect. And we're obviously going to be able to flash your website and your contact information.
Thank you.
Because I think to have a doctor like this is what I consider the ultimate. So thank you so much for being on my show.
Thank you very much.
And I'm looking forward to having you back again.
Thank you so much.
Thank you, everyone. We'll be back with my next guest.